Hello everyone, I am Dr. Aruna Kumari, consultant obstetrician and gynecologist practicing at Cloud9 Sarjapur and Bellandur units of Bangalore. Threatened miscarriage, the most common problem these days we are seeing. What happens? Pregnancy, as soon as it is positive, patient do come to us for the consultation. We do the ultrasound and see where is the pregnancy developing. And later at 8 weeks, we will call them back for the heart rate checking things and all. Meanwhile, sometimes the patient call us, doctor, I came today for consultation. You said all was fine. But suddenly after coming home, I noticed some brown discharge or some spotting is there. So these kind of features, when it is there, it is considered to be threatened miscarriage features. But we can prevent and treat it well by good progesterone support, rest, and avoid traveling and exertions. There are other factors which can contribute to the threatened miscarriage. So always check your thyroid, sugar, and BP, any factors are there. Sometimes, rarely, this anti-nuclear antibodies or Apla syndrome, these kind of problems can be there. So those things have to be treated and managed. So the management for threatened miscarriage is rest, progesterone support, and tender loving care by the doctor and the husband matters a lot in these kind of scenarios. See, so many times we would have already put progesterone and we would have counseled observation only. Now this is the features. 2 weeks later we have to check everything is fine or not. Just be under rest and use these medicines. But still the patient will be anxious. Doctor, still I am having little spotting. So little spotting, don't worry. Fetal heart rate checked by your doctor, be under rest. Sometimes tranexamic acid medicine will be added to prevent that spotting. So these medicines will not cause any problem or side effects. Consult back to your doctor after 2 weeks with the checking for the fetal heart rate. So this way threatened miscarriage can happen in 10 to 15% of the early pregnancy period. It has to be managed with rest, progesterone support, and good hydration has to be there. Whenever you are taking any hormone medicines, these progesterones and all, thrombosis risk will be there in pregnancy. So always drink water well. In first 3 months, you may not feel like drinking water. As soon as I drink water, I feel like vomiting, patient tells. That doesn't mean you should not drink water. Take in small portions like 15-20 ml now, again after half an hour. This way the dehydration also can be prevented. Take juicy fruits like apple cut pieces, muskmelon, watermelon, or cucumber, carrot cut pieces. 2-3 pieces dividedly will prevent the dehydration in the body, and progesterone support and rest has to be taken. And other way of managing the threatened miscarriage, we are finding that patient is getting good contractions, pain and all if it is coming. So we put some medicines and admit the patient and keep in the hospital. Tocolytic medicines also we may add. So and at the same time cervix length also we have to measure by ultrasound. So these factors it is there means if it is managed appropriately, and we can prevent the threatened miscarriage, leading to miscarriage can be prevented and better outcome can be brought. So always meet the doctor, consult, take the opinion, and sometimes having patience and following. Sometimes wait and watch is a better treatment than multiple times checking for the things. See, once the bleeding occurs little, it needs some time, 1 to 2 weeks to resolve on its own. So multiple times of checking with the ultrasound or consulting back and back to the doctor is not going to improve. So until it's not a major bleeding, no need to recheck again and again. So instructions given by your doctor, you follow that, and better outcome will be there for threatened miscarriage. Only the wait and watch and support with the progesterone, you have to take the medicines properly. That is very important.